All right. So this is our part two, urinary system disorder. So we talk about the UTI already. So that's why from the beginning of this part two, we need to talk about the treatment, which is all the medication. So when you're walking, actually you give a UTI medication a lot. Okay, you give this all this medication a lot. That's why I'm so sorry, and there's no excuses. And you can tell the uncles you don't know this medication because we reuse the medication every single day when the patient have a UTI. And of course, in the hospital, usually this UTI is more severe, so probably it's like a maybe more strong bacteria, or either way it's become like a urine sepsis already. That's why patient come to the hospital. So that's not like some kind of normal UTI anymore. So we are using like a more stronger IV antibiotic. But all this most of the antibiotic we are talking about for the LVN level, most of likely they're all kind of like a pill. Is a PO medication. So that's why you can just understand, okay, in the nursing home, so when we just give an antibiotic to treat a UTI, and usually is available, usually all this medication is available. So you're gonna have like a backup medication box, or either way the next day the doctor will prescribe all this PO medication, and the pharmacy is gonna deliver soon. The hospital will use lots of IV. Okay, the first medication we are talking about is a pyridine. Okay, so this medication actually is not an antibiotic and it's over the counter. That means you can buy it in the pharmacy by yourself very well. Okay, very easy. So this medication, the mechanism is kind of release the pain and burning sensation. So when your UTI is kind of like mild, actually, it doesn't kind of like feel like okay, you have to just buy a doctor very strong antibiotic order. So that's why you can get this pyridine from the pharmacy and you can take it. So it's you drink more water or cranberry juice. It's helping you to flush out with all this E. coli and the bacteria easier. So this is not kind of like a not severe UTI. We use it kind of release the pain and burning sensation and also urgent sensation. So the first thing is that first, this is not an antibiotic. Okay, so it only treat the pain and also some kind of symptom. So it's not cure the infection. So what's the mechanism is helping your the bladder is flush out with all these bacteria. So that's why we can buy this very easy. So it's shortened use only. So usually we use this medication like a 2 days to 3 days. Okay, usually we don't like use it like over 3 days. Here your textbook say do not take this more than 2 days. Okay, we can use it for the 3 days, but 3 days usually is kind of maximum already. So that means what? If you get a treatment for the periodian about like 2 days and is not like improve your sign and symptom, you need to go to see a doctor. That means in that time you probably will need an antibiotic. So this periodian is not working at all. So that's why remember this information very important. Okay, so it's not an antibiotic. We just treat the symptom and also short-term use only, just only like 2 days and 3 days. Okay. From now on, the UTI treatment and be careful with the day, how many days we treat, because there's a one very important information I'm going to talk to you. It's actually the NK is very important information. Okay, just remember the days. Okay. So, continue the periodian. So, urine discoloration. That means what? This medication will bring your urine become like an orange or red color. Okay, so far we learned two medication will change your body fluid. So one is rifampin. So rifampin is a TB medication, is an antibiotic. So we use the rifampin to treat the bacterial infection. So also will bring all your body fluid become like an orange color. So this is a second medication will change your body fluid. So it will become like an orange color, even like a red color. It could be a red color, but this is expected. It's not harmless. So that means what? When your patient is asking you, so how come when I pee and it's kind of red color? So that's why you need to rule out, is this a medication or you either way you have bleeding? Okay, is that bleeding or is it kind of medication? So if the patient tell you, okay, I'm taking like a periodian, so this is expected. That's why it maybe is not bleeding. But here is also another thing we need to notice is the patient is wearing the contact lens. Okay, the contact lens. We will tell the patient, okay, probably you don't want to wear the contact lens when you taking this medication because it will dye your contact lens. Your contact lens will become like an orange color. Okay, so that's why we don't want to wear contact lens. Just wear the like normal eyeglasses. And also, this medication will cause some kind of like GI upset, which is a stomach upset. This is also another common side effect. So remember this, okay? Most of our UTI medication, if this is a second line UTI medication, for sure they have a GI upset. So this is just a OCD medication, but just like a second line medication, they also have a GI upset. So when the patient just have nausea, vomiting, GI upset, we can take this medication with the food together, will decrease the irritation for your stomach lining. So we can take it with the food. Okay, this is also another information. All right. So the first antibiotic we are talking about is that this is kind of a first line medication. Okay, we have a three first line and three second line medication. So the first line usually we treat the patient UTI is not so severe. So within 7 days we use the first line. So you can see this first medication. The first one is a microbit, and the second medication is a Betron, and the third medication this is the Manuro. Okay, so this three medication is the first line, but you go to see how many days they are treating. So all this medication they are treating within 7 days. That means below 7 days. Okay, this is also another very important information. So that means what? Most likely, this medication they are not that strong. They are not that strong. That's why within 7 days. So if it is treatable, so 7 days later, we don't need to take this medication anymore. We complete with the course. So the first one, a microbit. So this medication, we take it like 5 to 7 days. Okay, 5 to 7 days. So like take it twice a daily or once a day. It depends on the doctor prescription. Okay, but some common side effect the same: nausea, vomiting. So lots of UTI medication will cause a GI symptom: nausea, vomiting. Okay, some is going to cause a diarrhea. Like a second line is going to cause a diarrhea. So take it with the food. The second one, this is Betron. Betron, this medication is a combination antibiotic. So it's combined with two antibiotics. Okay, it's a sulfa medication and also a trimethoprim. This medication, that's why it's become like another new medication. That's what we call is a Betron. So that means that if a patient have a sulfa medication allergy, so they should not take this medication. Sulfa allergy. So that's why Betron cannot be taken. Also the same. The combination taking this medication 3 to 14 days. So see, it is kind of like a period average is also like a 7 days, right? 7 to 10 days. So that means so if a UTI is a little bit severe, we use this kind of both antibiotic to kind of like eliminate the E. coli. Remember, so the first line medication, so we do not kill the bacteria. So that's why the microbit and also Betron and the Manuro, these three medication, we do not kill the bacteria. We don't kill the bacteria. So why this is very important information, I will tell you later. So remember you take an antibiotic and remember hydrate very well. That's why drink a whole full glasses of water. When you take any antibiotic, it's all the same. Okay, so that's why in other PowerPoint maybe I didn't put this, but all the antibiotic, please drink the water. Okay, drink the water. Okay, a lot of water. That's why it will helping you flush out with all the bacteria in your bladder. And please complete with your medication and stop early and the infection will may return. Okay, so if it's kind of upset your stomach, and please take it with the food. Nausea or loss of appetite and diarrhea, maybe. And also, this medication, Betron, have another thing is very sensitive to the sunlight. So what does that mean? It's a photosensitivity. Photosensitivity. We talk about a medication, we have a photophobia and also photosensitivity. These two big different things. The photophobia, I mean, is the eye. I cannot see the light. When the eye see the light, it's very trigger and irritate. So for example, like if we have a meningitis, so meningitis is a photophobia. So this disease, actually the light is going to trigger your brain activity. That's why patient will feel dizzy. So that's why it's a photophobia. It is the eye see the light. Photosensitivity, sensitivity means the skin is a skin. So that means what? When the skin is exposed to the light, and the skin will have some kind of rash, also burning sensation. That's why this is photosensitivity. So that means what? This medication pattern, when you go under the sunlight, you're gonna have some kind of like a sun rash or the burning sensation. So that's why we tell the patient, okay, when you're taking this medication, so remember when you go outside and just wear like a long jacket or like a the long shape of a clothes, okay, and a long pant. So do not expose your skin to the sunlight when you are taking this medication, and maybe also can put some kind of like a sunscreen. Okay, so if you have a sulfur allergy, please do not take it. Okay, so call your doctor immediately if you have a severe rash. Maybe it's also some kind of like allergy reaction. Okay, if this rash is not exposed to the sun, if it is not exposed to the sun, how can we know this rash is not the photosensitivity? Because if this rash is caused the blister, okay, if this blister will have like a bubble, will watering fill the bubble, that means what? That means this is not by the sun. The sun have some rash, unless you get a sunburn, right? So that means this is kind of like an allergy reaction. All right. So tell your doctor when you're pregnant or just breastfeeding. So all the antibiotic, remember this. Okay, if you don't know which antibiotic and I cannot just breastfeeding to the patient, please choose all the antibiotic because we do not really recommend so pregnancy women breastfeeding when they're taking the medication. Antibiotic is one of them. So most of the antibiotic will pass to the baby. So that's why we do not encourage the woman breastfeeding if they're taking the antibiotic. And also the pregnancy, some antibiotic will damage the woman, their kidney or liver, and also is also passed across to the placenta. So that's why when they're pregnant and also some antibiotic cannot take it. Betrin is one of the antibiotic. When you have a pregnancy or feeding, you cannot take it. Okay, you cannot take it. So Monuro, okay. So Monuro, this is kind of like a powder package. So genetic name is going to call phosphomycin. Phosphomycin. This is not a tablet. It's not the capsule. It's a powder medication. It is a powder medication. That means what? We have to mix with the water. We have a mix with the water. Okay, so this medication will kill the bacteria by permanently binding the cell wall. So that means what? Also cutting the bacteria, the small hand. Remember I told you to have like a small hand will grab your bladder lining. So they are not really kill the bacteria, it just kill their small hand. So that's why reducing the bacteria attached to your bladder cell or your bladder wall. So that's why they don't stay there. So this powder package, it need to be just put it in like at least 8 ounces of glasses of water. 8 ounces. So that means at least 240 cc. So mix with the powder very well and drink the whole glasses of water. So that's what will be effective. But of course, during the moment, and if you want to drink some more water, that's good. We recommend because you want to flush out with all the bacteria. The same common side effect, GI upset, diarrhea, and nausea. Okay, they also have some kind of the vaginal irritation with some kind of like yeast infection. So this medication will cause the yeast infection a little bit easier. Yeast infection. So that's why when a woman already have some kind of yeast infection, we do not recommend to use this antibiotic. So we will use other antibiotic. All right, so symptoms should be improved like 2 to 3 days. That means what? This is also kind of like a short-term use within 7 days. Okay, so if the kidney have some kind of infection like a pyelonephritis, so this is just only helping for the bladder. It's not for the kidney. It's not for the kidney. So most of all the first-line medication is not for the kidney infection. Okay, most of the first-line medication is not for the kidney infection. So remember this. All right, now we are moving to the second line UTI medication. So this is kind of like a very famous medication. We probably just see a lot. Keflex. Okay, Keflex in the nursing home we use a lot. Okay, so why we use the second line medication just means for example, the patient their bacteria is a little bit more like a nagging and like a patient a recurrent infection. They just have like a second time or third time infection. It's not the first time only. So that's why this antibiotic maybe is already have this bacteria maybe is already have some kind of like antibiotic resistant already. So it's a little bit difficult to treat. So that's why we have to use a little bit more stronger antibiotic. So that's why the second line antibiotic it is more stronger. So that's why they need to take it a little bit more longer, say over 7 days. Over 7 days. This is our second line antibiotic. So that means what? We want to make sure this antibiotic will be killed. So the second line antibiotic, they do have a function can kill the bacteria. Okay, they can kill the bacteria. Let me say that again. The second line antibiotic, so they do have a function. They can kill bacteria. This is very important information. So that means what? All the second line antibiotic, if I take it too long, if the bacteria is all killed in my colon, so will become like a colon super infection, which is a C. diff. Which is a C. diff. So have this kind of information very important. So that means what? So when the doctor prescribes like a Catholic, okay, so this is 7 to 14 days, right? Oh, I know, maybe like 2 weeks, okay. But if the doctor put this antibiotic too long, for example, like taking this antibiotic 2 months, and the patient have like a diarrhea already, so that's why you're gonna expect maybe this is kind of like a colon infection already, which that means it could be C. diff. So that means you need to report to the doctor, and you maybe need to collect the stool to do the C. diff testing, see if the patient is C. diff, because this is kind of like killing all the bacteria already. So they do have function and kill the bacteria. So this is the reason that's why we be a little bit careful to use the second line antibiotic, because they have a more complication happen. The same common side effect. GI upset, so nausea, vomiting, and mild diarrhea. Okay, so if the patient have like a GI irritation, take it with the food together. All right. So the Catholic, this is a separate separate medication. So if the patient have like a penicillin allergy, may also have like a cross-related allergy reaction. So that means what? The patient have a penicillin allergy. We do not use this medication. We do not use Catholics. Okay, we do not use a Catholics, this type of a medication. All right, so remember this, okay? So if a patient they do have a penicillin allergy, this medication we cannot use it because they still have a chance will get an allergy reaction. All right, second line medication. The second medication. This one is augmentin. Okay, also another famous medication. Augmentin, this is also combined medication. It's combined with the amoxicillin and also clavulanate. Okay, hope I pronounced it right. Okay, anyway, it's augmentin, you know it. So this antibiotic is also kill the bacteria. It's also kill the bacteria. So the same is going to cause the colon super infection if we use it too long. So that's why you can see. So this medication we use usually for 5 to 7 days for the simple bladder infection, but most likely it's not going to be simple, right? We use it because it's a kind of like a more severe infection. So like a kidney infection. So that's why we can use it as augmentin. So will be required over 7 days, like 10 to 14 days. See, 14 days is also another limitation, right? Again, if this medication that is just being used like over a month and have a chance patient is going to have a C. diff. So that's why remember if a patient have a soft, loose stool, that's okay. But with a watery stool for a couple days or a couple times per day, that means it's suspicion of C. diff already. All right. Remember, augmentin was also treated for the pediatrics, right? Also treated with the otitis media, the ear infection. Okay, so that's why this medication usually, if infection is more severe, infection is kind of more in the deeper of your body, we can use this medication, but not too long. All right, the last one is a Cipro medication and also Levaquin. Okay, so this is also famous medication, Cipro and Levaquin. This is even more stronger medication. Okay, ciprofloxacin and also levofloxacin. So it's a floxacin medication, Flosacin, floxacin medication. So the floxacin medication is more stronger, and the floxacin medication have more complication. the more stronger medication, of course, is more dangerous, right? So that's why we need to be very careful to use, okay? So that's why this medication, again, we do not use very, very long time. So see on the bottom here, okay? So Cipro, we can treat a UTI maybe like a 3 to 14 days, and the Levaquin, we treat a UTI like a 3 to 5 days. Okay, so that means what? The Levaquin even is within 7 days. So you're thinking about, oh, it's kind of like a first-line medication. No, Levaquin is a little bit different. Levaquin is a very strong medication. It's a fluoxetine medication. It's strong. The reason 3 to 5 days is because they can kill the bacteria more easier. So that's why 3 to 5 days, it should be okay. It should be good. Okay, it's strong, but the problem is that they also have like a very strong side effect. So I will tell you. All right. So the Levaquin was covered both like a gram positive. So Cipro is covered with a gram negative. So that's why if we know what kind of like a bacteria is belong to the gram positive or gram negative, that's why we can choose the different antibody. So like Levaquin or Cipro. Okay, it's Levaquin or Cipro. But a recurrent UTI, usually we may use the Cipro. It's better because Cipro can use a little bit more longer. But again, side effect is severe. Let's see these two medications side effect. All right. So first, sun sensitivity. So both were making like a sunburn and rash. Okay, we talked about earlier about the sun. Photosensitivity already is a skin. So it's a skin. So that's why remember when we go out, put some sun blocker, sunscreen, or just wearing a longer sheet of clothes, like a jacket, okay? Also will cause a GI irritation, nausea, vomiting. Okay, this is very normal, right? Antibody usually will do this. That's why take it with the food. But here is some kind of like side effect. You have to remember it's very special. So it's going to cause a severe tendonitis or tendon rupture and also the nerve damage and also the central nervous system effect. So here is kind of like the peripheral the nerve effect is a pain and burning tingling sensation or weakening on the extremity. That means your hand and the leg is kind of weak. Okay, because the neurotransmitter is not going to your arm and your leg very easy. So for the central nervous system will cause a confusing and also disorientation, agitation, hallucination, also seizure and psychosis, autopsy and encephalopathy. So you can see if long-term use this medication will damage to your nerve system, your brain, and also your spinal cord, and also for your tendon. So that's why NCAS will asking you something. For you just using in the nursing home, the senior people that use this medication, and then suddenly just tell you, okay, I feel like my joint is a little bit painful, but I don't have arthritis. I do not have arthritis, but my joint is a little bit painful. So whenever walking, it seems like it's kind of like my muscle is kind of like it's going to become like a tear. The feeling is painful with tear. That feeling. So usually it's two kind of medication will have this kind of effect. One is a statin medication. Remember for the cholesterol. So they have a rhabdomyolysis. And another medication is this, fluoxetine. So this medication will cause a tendon rupture and also tendonitis. This is the early sign of like a complication. It's not damage to your nerve yet, but it's the early sign. When you notice, please, you can stop this medication. Usually we talk about, as a nurse, you cannot stop the medication, right? But this antibiotic is a bit dangerous because it will cause like a CNS, nerve system damage. So that's why you can stop this medication and call the doctor immediately. Tell the doctor, hey, the patient is confused right now, or the patient is telling okay about like a wrist or like a ankle. It's very painful. I think it's a tendon. Her tendon is have some kind of like a tear already. So we better just start this medication. So when the tendon just have some kind of damage, the tendon is also belong to the muscle system. That's why they can be healed. It takes time. For the elderly people, it takes more longer time, like a couple of months, but it still can be healed. That's fine. That's why when we start this medication, so the patient, their symptoms should be slowly and gradually get improved. But again, so this medication we use it to treat the bacterial infection. If we use it to treat the UTI, please do not use it too long. Okay, this is a severe side effect. All right. So now this is we go into the fundamental of nursing. So this is lots of fundamental of nursing nursing assessment, also intervention. So the first thing is a catheter. Okay, the catheter. We do have lots of catheter, right? So also sometimes of the patient they can do like a self catheter. For example, before we talk about like a cup pouch, right? And later on we're going to talk about more. And this is kind of patient that bladder is not doing like any function. They cannot pee. That's why we put on the tube, which is a catheter. The most famous one is a Foley catheter. Okay, so this is all the catheter you can see from the nursing home, but majority we can see is at the left side. The bottom is two. So the bottom, this one, the self-retaining, this is the Foley catheter. We see it most likely a lot. It's easy to use. So that's why they have a two port. Okay, one is for the balloon. So when you fill the balloon will be like here, will be just kind of just stacking on your bladder. That's why the catheter won't be come out. So that's why catheter will stay there. And another one is for the drainage, for your urine drainage in the middle. But here also have another one. When you're working in the rehab or like a post-surgical unit, you're gonna see this catheter a lot because you need to do the flush, okay, irrigation. So this is three-way Foley catheter. That means what? One, the same is for the balloon. Another one is for the urine drainage. That's fine. No problem. But here they have another one more port is for the irrigation. So for the patient, maybe they have some kind of a surgery, for example, like a prostate surgery or like a bladder surgery. They have a lot of blood inside. The blood will have a blood clot. So the blood clot is going to be clotting the urethra. That's why patient have a blood clot that they cannot pee, and constantly bloody inside. Actually, we don't like it. Okay, it's cause lots of the clot. So that's why you need to irrigate. You need to irrigate and like in and out, and take out with all this blood clot and constantly. That's why they don't have any blood clot. But the irrigation we're going to talk about in another class. Here on the right side, Coude. So you probably heard Coude. I probably you saw the Coude before. Coude is used for what? Coude we are using for the patient have a very difficult to insert the Foley catheter, for example. So maybe it's an enlargement of a prostate. Or either way, the patient is too nervous and is fighting with you. So that's why you have a hard time to put in the Coude. Coude is a little bit harder, but the different thing is that the Coude, you see the front. So the tip is just like a hook, a little bit like a hook. They have an angle. They have a certain angle. So that's why it's a little bit easier when you can just insert it. They will go into the bladder a little bit more easier. So that's why sometimes we use a Coude if we just feel I have a hard time and to put the catheter to the patient. And then you can see this is all the mental style. So I'm sorry, this is only going performed by the doctor, so you cannot do it. But you can know what's the reason we're doing it. If even the Coude is not working at all, that's why doctor will use this. We'll put one of metal in this kind of catheter and we'll kind of force and put it into the patient's bladder. It hurts. It really hurts. Patient will scream. Patient will beat you. Okay, so that's why sometimes we need to sedate the patient or either way restrain the patient. That's why we can put this. It hurts. But the problem is the patient cannot pee, have like a severe complication. So that's why we have to use this and put on the Foley. And then the doctor will take out with all these mental things. Alright, and this is the Foley, and you can see here come with a Foley catheter nursing care. Okay, so is the infection prevention most likely because when we have a catheter there for a while, and the patient will go get an infection very easy. So we call this is a catheter associated urinary tract infection. It means a catheter associated UTI. So CAUTI. Care. So you can see each of the section here. So please wash your hand every time if you touch the catheter, okay? And also wash your hand after if you touch the catheter because they have a bacteria there. We don't want just bring to cross-contaminate to another patient. And remember, keep the drainage below the bladder. So that means what? If the patient is walking, so that means you can just hand on the walker. So that's why patient is walking with the walker, and they will be handing with the walker, handing with the Foley bag. But the patient cannot hold it in the hand and walking like this because it's over the bladder. So that means what? All this urine will be back to your bladder. We don't want the urine go back down to the bladder, no. And especially, maybe it's already has some bacterial growth already. It means the bacteria is going back to the bladder. So that's why below the bladder, okay? And also make sure the bed never touch the floor because floor is dirty. So either way, okay, you say, oh, it's just a folly bed. Okay, folly bed is not just go into the patient's the bladder, right? No, the reason is because they don't want this is because when your PCA, when your CNA or when you just empty all this bladder, this urine bag, so you're gonna be accidentally touched with all this urine bag. If it's on the floor, you're gonna touch the bacteria, and then when you manipulate, when you're doing this kind of Foley catheter care, you may touch the patient's perineal area and will bring the bacteria into their bladder. So that's why NCAS doesn't want to see the touch the floor, okay? And also, please maintain a closed drainage system. That means what? So all this system is all closed, is all sealed. So it should not have any kind of opening. So if you see it's kind of leaking, the catheter is leaking the urine, okay? So that means what? That means you have some kind of hole there, is leaking there. So that means the bacteria can go into that hole very easy. So that's why we need to change it with the whole of Foley catheter, even the bed, everything. That's why you need to maintain a closed system. That's why bacteria have no way can go into the bladder. All right. Clean the perineal area in the first few minutes, few inches with the catheter daily, and after the bowel movement, and use the salt and water. That means every time the bowel movement, you need to do the catheter clean care. Okay, every time the bowel movement, we need to do the catheter clean care because your stool has E. coli. Your stool has E. coli. You want to make sure the E. coli have no chance can go into your bladder. That's why every time, please clean the patient. Also do the catheter care. All right, the next one. So we need to secure the catheter. That means what? We usually will tape it on the patient's side. Okay, secure it. So what's the reason we need to secure it? Because we don't want the patient just accident just pull out the catheter. We don't let them pull it out. And the secure layer actually is helping the drainage better. So that's why you don't keep like a moving around and a folding layer and going here, going left side, going the right side. And patient also will feel it's kind of painful if they don't secure the catheter. It's just hanging there. All right. Check frequently with a king and a band or like a dependent loop. That means what? The catheter is not draining with any urine output, so please go to see if it's any kind of like a band or king. Okay, or with some kind of a blockage. So that's why we will maintain the whole system with draining the urine very well. So that's why make sure if a patient suddenly is not draining with any urine, so what should we do? The first thing is that if this kind of like a device is not working, what should we do? The first thing is that please check your patient. Please check your patient. So go back to palpate the bladder or do like a bladder scan and see if a patient have like a distance of a bladder area. How is the patient feel? Is that painful? Is that sore? Asking the patient, please assess your patient first. And the second one, please go to check your device. Go to check your device. See if your device is kind of malfunction. Okay, malfunction. So that's why if a machine is not doing anything, our device is not doing anything, we need to change the new one. All right. Here, empty the collecting bag frequently and regularly. So that means what? You don't want to wait until it's full and then you empty it. Why? Because if it's full, first, the chance it will go back up. We don't want the urine go back up. So that's why please empty it so regularly. And the second thing is, so by empty this kind of like a behavior, we can make sure the bacteria have no chance will go back up, will go upper to your bladder. Okay? Oh wow, my internet is unstable. Hello, can you hear me?
Yes.
Okay, my internet is suddenly just breaking. All right, good. All right, so at least every 8 hours. That means what? Every day I need to see 3 times the people, the nurse is clean and empty with the urine bag. Every day at least 3 times. But usually we don't do like a 3 times only. So when you are working, usually you do a little bit more. So maybe like a 2 times per shift. Because one time you need to do the assessment. Another time when you're leaving and you want to empty it and just give it to another nurse, right? Usually we do like a 2 times. But at least NK is asking you every 8 hours you are supposed to be to empty with your urine bag. All right, the next one. So the monitor and record with the urine output. So that means what? When the patient already have like a Foley catheter, that means what? The in and out, intake and output become like necessary. So that means you have to do the intake and output necessary. So what's the reason we want to do the intake and output necessary for the urine output? Because we want to know the patient hydration. Is the patient dehydration? Is the patient peeing? And also when the urine output is kind of below 30 cc per hour, that means significant the patient have something wrong with the hydration status, or either way the bladder is not functioning, or maybe is a king, or like a blood is sitting there. Okay, the blood clot. So that's why you need to do the assessment. So that's why intake and output, the whole ship is very important. Remember the intake and output also have a number, the NCLEX question, right? For example, if a patient just have an IV hydration, also the patient drinking. So for example, it's about like a 1000 cc and during your ship, but the patient urine output just only have like a 300 cc. So that means another 700 cc was missing, right? Okay, we can accept if it's not coming with like 1000, if it come out with like 800 or 900, that's reasonable because your body maybe also will use some water, but this is kind of the way too low. If below like a half, like a two-thirds, that's really too low. That means you need to check with the patient intake and output what's going on with that. And also assess with the urine color and the clarity or odor. So what's the color? Is that amber? Is that red? Is that dehydration or is bleeding? And the clarity. So that means what? Is that clear or cloudy? That means it's infection. That's why it's cloudy, right? And the odor. How does it smell? So when you empty with the urine and you can smell it, right? Is the smell very bad? Because when this is kind of infected already with the UTI, usually the odor is very strong. All right, so present with some kind of like blood, that means also red color. So please document the catheter insertion date and also the size and also the blue volume and also the patient tolerance. Right? Usually the most important thing is the insertion date because usually we need to change the Foley catheter by the protocol, by each of the hospital protocol. Okay, so every doctor have a different idea. So if this patient is kind of long-term illness, for example, like a spinal cord injury or spinal bifida, or patient have like something wrong with the bladder, or either way with the surgery, we need to keep like a 3-way Foley catheter there for a while because every day we need to irrigate. So that's why the first day insertion day is very important. When do we put it? So the doctor will assess, okay, how many days I need to change another new Foley catheter, or either way I need to DC the Foley catheter. All right. So the catheter size is also very important. Usually we use a 16 French, right? This is for the normal people. But some people is bigger, you need to use the bigger size. Some people is smaller, use a smaller size. Okay. Or if you choose the wrong size, it will cause a leaking. Will cause a leaking episode because all the urine will be leaking from the bladder area. All right. So this is also another your fundamental of nursing is called bladder training. Okay, we have the bladder training for our pediatrics patient already. We talk about in the kids, but now this is a adult bladder training. Okay, so that's why this is going to be go a more detail. So NCLEX is like to asking you with about training, also bladder training, because they want you make sure you constantly to assess the patient and also assist the patient, helping out with your patient, and that's why your patient doesn't feel shame if they just pee on the pan or pee on the pee in the bed. So here, the first thing is to keep like a diary. So see the tracking of the patient, how many times go to the restroom, and the fluid amount, how much they're drinking the water, and the leaking episode. So that's why you can keep like a diary. But here, the important thing is that please set like a baseline schedule. So that means what? Usually, we would like to have like a regular schedule for the patient every day. So why we're doing this, I have one picture in the end. That's why I can talk about this. I will explain to you. So with the schedule, your brain actually will telling your body, as also telling your spinal cord, hey, it's about the time you should relax. Okay, go relax. That's why you can pee, you can poo. Okay, so this is kind of regular schedule. That means what? It's kind of like a body clock. It's a body clock. So that's why Some people actually, and the body clock is kind of like is very regular. So by certain of the timing, they say, okay, I'm going to do this or I'm going to do that. For example, for some people, very obviously is sleeping. So some people they tell you, okay, now it's 9 o'clock, I should go to bed. So I usually sleep at 9 o'clock. So my body clock is like a regular like this. All right. So some people are telling you, okay, so I go to the do the number 2. So every day in the morning, like 7 o'clock. So when I wake up, the first thing is I go to do my number 2. So that is kind of like a training. Okay, so it can be trained. So that's why we set a baseline schedule. So that's why what is the patient the baseline schedule? Every day we try to follow exactly the same schedule. Okay. And here, management of fluid, it doesn't mean the patient will pee and will leaking or something. That's why we limit with their intake. Remember, I told you usually, usually the normal people one day need to pee at least 1 liter of urine. At least 1 liter, but we wish can pee a little bit more, right? So that's why NCLEX here is telling you, okay, please give at least like a 1500 cc water per day. All the fluid, not just water. So it can be up to like a 2 liter. So make sure your patient is hydrated well. But this fluid is kind of spray close the day. That means what? Patient is not drinking all this fluid in one time. No, it's not. They cannot tolerate with so many fluid in one time. No. So that's why it's spray out. That means what? So all the 24 hours. So that's why I will do my daily the schedule. So when is the time I just made a patient drink a bit more. So if a patient is sleeping, okay, if a patient is sleeping, so that's why we can cut the 2 hours before they go into bed. So that means what? If a patient is sleeping maybe about like 10 o'clock, so that means what? 8 o'clock, I will start giving a little water, not a lot of water. So that's why patient doesn't need to give up to the bed and go to pee all the time. And also patient need to sleep. So if a patient is sleeping and they need to get out to use the restroom, most of the chance likely they're going to fall. So that's why we want to prevent a fall risk. Okay. So that's why this is the reason we cut back like a fluid like 2 hours before they go into the bed. So before that timing and also when the patient is sleeping, even when the patient is sleeping, do we still need to give some water? If they wake up, yes. If when they wake up, we still can give some water, okay, but not a lot of water. Usually like a half cup to 1 cup of water, that's fine. That's fine. But in the day timing, so how can we give the water? Usually 1 hour at least, 1 cup of water. Every hour at least 1 cup. That means what? 8 ounces of water every hour at least. So if you can do more, can like do like a 2 cup, that'll be good. That'll be good. But at least, so for the normal people, you need to drink 8 ounces of water every hour. So that's why maintain. You can go to the restroom like every 2 hours or every 3 hours. Okay, so limit like irritant, that means what? So caffeine or alcohol and artificial sweetener. So for example, like a diabetes patient, they usually use lots of artificial sweetener, right? That's actually will trigger your bladder spasm. So that's why we do not recommend to use it anymore. We don't usually recommend to use it anymore. So that's why before we want to control the diabetes. So that's why we will always tell about, okay, artificial sweetener is so good, right? So fancy. So it's not real sugar. So we'll control patient diabetes very well, right? That's kind of like a nursing style or medical style is gone. We don't like that anymore because artificial sweetener actually is harmful to your bladder. It's called spasm and also is not natural. So we will rather to give a patient the real sugar. Okay, even the patient with diabetes will rather to give them the real sugar. That's fine. Why? Because I have a medication can control. That's fine. But I don't have a medication can control your bladder spasm. So that's why I don't want you to have a spasm. So this is the reason. That's why we will limit with the artificial sweetener. Okay, this is very important information. Lots of old style nurses they still don't know this. So that's why you are new generation of nurse. That's why you need to tell these old nurses. Okay, the reason we don't want to use this is because of 2 reasons. One is because it will trigger the bladder spasm. Another one is a potential cancer. Okay, artificial sweetener will have some kind of potential will cause the patient have a cancer. So that's why now we stop using it right now. We don't want to use it. We use a real sugar right now. Okay, so Implantation intervention, schedule avoiding, because we want a patient to have like a good schedule and in that time, so like a fix the time clock, then they will have like the brain will tell in your spinal cord, will tell all your muscle, hey, relax, it's about time, you can go pee or you can go poo. So that's why we have like a schedule timing, especially so in the nursing home, we do have this timing. So everybody will go to drink, everybody will go to use the restroom. Okay, so such as like a 60 minutes. So you don't have to like do a 60 minutes. Every 2 hours is fine. Every 2 hours is fine. And also the reason is schedule of the patient avoiding. Also every 2 hours you go to check a patient. That means that you what? Constantly assess the patient. You do the assessment to the patient every 2 hours. So that's a good thing. NCLEX like to see that. They want to see all the time you come here to check your patient. Like your waiter. Your waiter come back to check you. What do you need? Do you some more water? Do you want some more coke? How is the food? Like your waiter. Remember, you are the waiter in the hospital, in the nursing home, okay? So go back to check your patient every 2 hours. All right, gradually increasing. So that means what? When we do the schedule training, so that's why we want like a little bit add on the timing and for the void interval. That means what? So if I'm training the patient their bladder right now, the first time I'm gonna train the patient, okay, 2 hours later, so I'm gonna come over and helping you to use the bedside commode or toilet. So when I train the patient, maybe like a couple days, like a 2 day or 3 day later, so I can add 15 minutes. That means what? I will come back 2 hours and 15 minutes. Okay, I will let you just hold your urine a little bit to train your bladder muscle. To train your bladder muscle, get used to it, can hold the urine a bit more longer. Okay, because this is also good for the incontinence training. So that's why when we add until the when. So the goal is 3 to 4 hours. So that's why. So 3 to 4 hours, if they can hold a urine 3 to 4 hours, that will be fine. But let me tell you, okay, this is by the textbook. Okay, it's by the textbook. So the goal is if we can hold like a 3 hour, actually it's good. It's perfect already. Yeah, you don't have to like do the 4 hours because the grandma and grandpa, their muscle is not so strong. So 4 hours is a bit too too late for them. Okay, so that's why we still like them to like go to the restroom like every 2 hours. So that means what? So the good thing is now we don't have a lot of movie. It's over like a 3 hour, like what, like Titanic. 3 hours, right? Yeah, so that's why they go to see the movie and they need to go to pee, and then they don't want to go to the pee because they want to see the movie. They're holding their urine. Do you have that experience? Okay, so that's why. So you need it in the middle and just pass with some kind of activity and just bring it to the restroom. Okay. All right. So the next one. So distraction technique. That means what? So take a deep breath and slow counting, and also kind of like distract with your bladder irritation. So if some people have some kind of like irritable, like a neurogenic bladder. So if they just have some urine, they think about I need to go to the restroom right now. So that was also like before the timing. We use like a technique, but we don't like to do that anymore because we want to train your bladder muscle is better. So that's why tell your patient, okay, when you just go to your restroom the next time, we still have 1 more hour. Okay, I need you just thinking about like relax, also distract. Think about okay, you're doing something. Okay, take a deep breath. Or do you want drawing, or you want just writing something, and or you want to talk to me, or you want to sing a song. So that's why distracted. So 1 hour later, I will bring you to the restroom because this is kind of training. But of course, if a patient cannot really hold it, so just bring the patient to the restroom. Okay, there's no reason you don't want a patient to pee if they cannot hold it. All right, another famous one is, of course, our pelvic floor exercise. It's our KQ exercise. So KQ exercise always good. Remember, NCLEX like to see some kind of like a very good answer, right? We have yoga. So KQ exercise is always another answer. It's always good. 100% perfect answer. Okay, so if you want to choose the correct answer, please do not forget the KQ exercise. Whenever you see the KQ exercise, I do not care what kind of activity, I do not care what kind of surgery. Even a surgery, even it's kind of like a heart surgery, our lung surgery, our brain surgery, I do not care. Okay, so you can choose the KQ exercise. It's not going to be wrong. It's not going to be wrong. This is an NCLEX requirement. They want everybody know how to do the kick-kill exercise because this is only a good benefit. It's nothing harmful for the patient. 100% is good for the patient. Nothing harmful for the patient. That's why remember kick-kill exercise. When you see if you need to pick a correct answer, please pick this answer. Okay, please pick this answer. All right. Evaluation, also patient education. So monitor and monitor the progress. So that's why review the patient like blood daily, weekly. Okay, the see the interval is improving and is getting more longer or actually is getting more shorter. Okay, is any kind of like a leaking episode or dripping, and how is the patient feeling? Is the patient still feeling like urgency every single time you need to go to the restroom? And how is the patient improvement? Does the patient also need to take lots of medication? So that's why you have some kind of like a blood training log. So you have like a log. So usually, so if the doctor orders some kind of blood training log and in the long-term care, so that's why you fill it out, and then maybe about a couple days later, or 1 week or 2 weeks later, you just turn it to the doctor. The doctor will see, oh, okay, so this is improvement. So that's why maybe I can decrease the medication. And of course, provide a positive reinforce, right? So that's why give the patient some time, okay? And also, please do not scold the patient. Don't tell the patient, okay, you pee. Oh my God, shame on you. Okay, they are not a children, they are not a kid, okay? They're adult. So treat it like an adult. So that means what? Give them some kind of good positive effect. Okay, say, hey, you know what? It's okay if you cannot make it this time. Don't worry about it. Okay, I will clean. Okay, I will change your diaper. Let's try the next time. We always have next time. Let's try it next time. Okay, I'll be here with you. Do not worry about it. Nothing be shame. Okay, I'm your nurse. I do not judge anything. Okay, I'm here to help you. So that's why provide some kind of positive information. You'll be helping the patient cooperate with you. Prevent a complication. So watch the side effect with a urinary infection, also like a skin breakdown. So the moisture. That means what? If the patient have like incontinence. So that's why remember go to check their diaper all the time, right? And also if they're leaking from the folic acid, that's why remember also go to change. Okay, and wash out with the perineal area. All right. So this is also another your fundamental of nursing, urinary incontinence. Okay, urinary incontinence. So this is not kind of like a urinary system. It's also like your term one study. So that's why in the term one we talk about a little bit, but we don't talk about that so deep. But here, because the urinary system, we talk about a little bit deeper. Okay, especially you working in the long-term care. So lots of patients will have like an incontinence problem. So incontinence, we have 5 types of different incontinence. We have a stress incontinence, urgent incontinence, overflow incontinence, functional, and also mass incontinence. Okay, so most likely the incontinence we saw a lot is a stress and also urgent incontinence. Most likely we saw these two, and also the combine together combination. It means a mixed incontinence. So the stress incontinence means that when the patient, so when they're coughing or sneezing or laughing and they're doing some kind of like increasing the pressure inside their body. So that's why, and the bladder with this kind of pressure will accidentally leak the urine, will leaking the urine. Okay, leak. So that's why patient feel like a shame. Say, oh, every time when I laughing, every time when I coughing, and then I will leak the urine. So usually this happen to the woman, especially for some woman that delivering a baby. So if they have a baby, and especially they have a multiple baby, not just only one, couple baby, that means what? Their muscle is kind of loose. Is not be able to hold the urine in the bladder. They cannot hold it very well, and especially if they don't do the kick exercise very well. That's why kick exercise can help for this. So this is stress incontinence. The urgent incontinence means what? So I need to go to pee. Okay, I need to go to pee. So it's hard to start, and unfortunately, I just pee. I cannot hold it anymore. So, for example, like your grandpa and grandmother are in a hurry, I want to go to the restroom, I cannot hold that so long. So, for the normal people, maybe you can hold like maybe 3 minutes and go to the restroom. But for them, they cannot hold. Maybe just like 10 minutes, just like 1 minute, and they just I cannot hold it. Just pee because their muscle is not so strong, can hold the urine very well. So that's why it's called the urgent incontinence. All right, overflow. incontinence, that means that the bladder does not empty completely. So that means what? Usually it happens to the patient, they do have some kind of like a brain trauma, so that's why they have some kind of urinary retention. And also like a grandpa, they have like an enlargement of prostate. So that means the prostate is kind of big. So that's why it's blocking the urethra. So that's why urethra cannot the bladder cannot fully empty the urine. So that's why it's become like overflow incontinence. So for this kind of like urine, they will become like this. They are not empty completely, so they will have a dripping episode. Drip, 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 drip. So either way, when they are walking on something, the urine will drip on their pants, on their underwear. Okay, so that's why. So it's kind of overflow incontinence. It's by the pathology. Okay, the next one, the functional incontinence is a physical or mental impairment. So that means what? So when you just have some kind of like for example, you have some disease. Okay, you have a disease already, and it's not able to making you and to go to the restroom very easy. For example, the patient have a dementia. Okay, so nothing wrong with their body. Okay, but the patient have a dementia, they just don't know how to go to the restroom. They forgot how to unbutton their clothes. They forgot how to pee. They even forgot how to just go to the urinal to pee. Or the patient just like this, they have like arthritis. Okay, they have arthritis and they have very hard time and to go to the restroom, and because they maybe need to use a walker or unbutton with the clothes, it's also very difficult. So that's why if one disease will infect to you peeing, that's the cause of functional incontinence. All right, and the missed incontinence usually is a stress and urgent incontinence. Usually, it's like these two together. All right, so incontinence we can just use some kind of like a procedure, like a surgery procedure or Botox or temporary or urinary deviation. Okay, can do some kind of like a small surgery. So for example, like we can just open the neck of a bladder. Okay, or either way, just constrict the neck of bladder, make it more tighter. That's why that causes leaking. But is that working all the time 100%? It depends. It depends. Not everybody will like this, okay? All right. So this is all different kind of incontinence. And here we are going to the incontinence nursing care, okay? So usually we know identify what kind of incontinence, right? That's why we can know, okay, how can we help you and review the pattern. So what's the trigger? If it is coughing and laughing sensation and like this, so that's why you don't want to tell your patient, okay, don't cough and don't laugh. I don't want you to have any fun. Okay, I don't want you laughing at something. No, you don't do that. So if a patient already have this kind of problem, okay, you tell the patient, okay, do the kick exercise is good. If not, also we can just put on the pad on your underwear. Okay, put a pad on your underwear. So that means what? That means that the patient, they still can enjoy their life. So that's why they don't feel embarrassing. They're actually just leaking and urine on their pants and on their underwear. So that's why I have several pads in their package. So in their pocket or in their purse or wallet, whatever. So that's why they can go to the restroom. They can change it constantly. So that's why some patient maybe they're still using the pad even after the menopause. That's why you're thinking about why they are after the menopause they still want to use the pad. Well, some pads is actually for the urinary incontinence, especially like a stress incontinence or urgent incontinence. Okay, that's why don't judge. Okay, they have a difficulty. All right, check the medication. Some medication will cause a urinary retention or relaxation. For example, like a sedation or anticholinergic. Sedation will make the patient too relaxed. That's why sometimes the muscle is not holding urine. That's why patient will have incontinence, will pee everywhere. Anticholinergic, that means what? Anticholinergic effect make a patient more nervous. That's why patient cannot pee. The whole bladder is kind of a little bit like a spasm. The sphincter is spasm. That's why they cannot pee. So that's why check the medication. If the medication has something wrong with that, and please report back to the doctor. Assess the skin. Okay, see with the perineal area and daily with the redness and irritation or breakdown, and with the moisture. Okay. And usually we can put like a skin barrier after we just clean the patient. Skin barrier is also a good thing. Right? Of course, we like to do the bladder training for this patient, like at least like every 2 hours. Okay, slowly increasing if we can go to like 3 to 4 hours, if that's possible. If not, at least every 2 hours, we bring the patient to the restroom. And the pelvic floor exercise, which is mean the kick-out exercise. Okay, will kind of like a stronger with their sprinter and also their muscle. And the dietary modification, like coffee, alcohol, artificial sweetener, again, okay, the citrus juice, okay, the citrus juice, and the reason we don't recommend is like orange juice, this kind of things. First is sweet, and the second thing is that they will cause the acidic ashes. Acidic ashes. So acidic ashes is not very good for the E. coli, right? The E. coli can survive there. So that's why E. coli no, sorry, I said the opposite. So the citrus juice will cause alkaline ashes. It's alkaline. It's not acidic. Alkaline. So E. coli like the alkaline environment. So that's why citrus juice, if they have like a alkaline ashes after the metabolism, so you can not just you just get infection very easy. So that's why we don't like it. So that's why we still like to recommend with the acidic ashes food and also like something like a cranberry juice. That will be the difference. The citrus is not a recommend. Fluid management. Spray the fluid intake. So again, so that's why you want a patient just drink the water and spray out, not just only in 1 hour drink all the water. Okay, just have like a 1 cup or 2 cup of water every hour. Just bring in the water every time, and also assess the patient condition. See if they need to go to the restroom or how do they doing right now. All right, restrict the fluid 2 to 3 hours before the bedtime. Usually it's 2 hours. We cap it like a 2 hour. Skincare again, so apply the moisture barrier, which is kind of like a skin barrier, okay, and clean and dry. All right, so this is some kind of like a device we use in the long-term care. So you can see on the upper here on the right side, this is urinal for the men to use, okay, but on the lower on the left side, this is for the female. Do you know the female have a urinal? Yes, we do. Okay, so that's why you can see the type is different. The female is a little bit more like going out like this, and holding like a little bit more bigger. So this is female urinal. So when I was working in the Huntington Hospital, we have lots of this. Okay, because we are also paid. So patient have a surgery, they cannot get out of the bed. If the doctor doesn't want to put on a Foley catheter, that's why we have to use a female urinal to the patient. And on the right side, of course, you know this is a condom catheter. Okay, so that's why we put on the condom catheter on the male patient, and that's why attached with a Foley bag. Okay, with the bag. So that's why they can drain out. Usually, we use this patient actually they have a hard time to get out of. Patient is dementia. They cannot follow you. They cannot walking very well. So that's why in the nighttime we can put on the condom catheter. That's why they don't need to give up. So that's why they can pee nicely. And in the morning we can take it out. All right. And the left upper one is our famous superstar device right now. It's just become so popular right now. This is called Puric. Okay, Puric. So it's for the female. So that means what? This kind of tampon things the female actually need to just close their leg. So the tampon actually will attach to the suction canister. So there will be suction. Okay, so that will be suction out with their urine going to this canister. So that's why it's put on the patient like a perineal area. So when they pee, they will suction. But actually, it leaks a lot. It will leaking a lot. So that's why we still like to put on the patient on a diaper. So at least if it's leaking, and I will change the diaper. Okay, that's why patient doesn't feel like okay, it's leaking everywhere in my bag. Okay, so usually this is for the patient they're going to sleep and in the night time. So that's why they don't need to get up. We use a Puric. All right. So we finish with most of UTI and bladder training and also incontinence. We talk about a little bit. We talk about one kidney disease. Okay, this is all the kidney disease with all of this. That's why kidney was in kind of different kind of shape. Okay, in the LVN level, we talk about all this kidney disease. So the first thing is that we're talking about urinary retention. Okay, it's not really a disease, but it's a symptom. So what happened to the urinary retention? It could be by the medication. It could be by the sedation. It could be like a too relaxed or like a too tight or like anticholinergic medication. That's why we're holding with all the urine. So it's kind of obstructing infection inflammation. Also could be like a neurogenetic bladder spasm, and the bladder become like distended and can be palpate. So that means what? You can feel the bladder actually is kind of like a distension, and when you use the ultrasound machine, you can see there's certain of urine inside there. is the inside layer. That's why it's called a retention. Urine wasn't be able to pee out. Okay, so this is urinary retention. So you can see the picture here. Okay, this is normal healthy bladder, and this kind of retention, the bladder is over like a half already, but the patient still cannot pee. Usually we have like a 1/3. We have a 1/3. The patient should feel like urgency they should pee, but this is a half already. The patient still cannot pee. That means what? It means something wrong. So here, like a 50% we like to see is a full bladder already. We don't want to get a bladder is really full. That's what we call a full bladder. Why? Because the bladder is going to be very distended. It's going to be very discomfort. And the patient is going to become like a very agitated. So this is the reason. That's why we don't wait on the full bladder is kind of full, totally full, like a half. We talk about okay, the bladder should be empty already. All right. So intake and output catheter is very in and out catheter very important. This is not intake and output. Okay, it's in and out catheter. That means what? When I put it in and I will take it out later. So my reason to put it in the catheter just I want to drain out the urine. I just want to drain out the urine. That's it. That's it. I just want to drink out the urine. So that's why your nursing intervention is kind of like go. Okay, I take out the urine retention from the bladder. So that's why I will monitor the intake and output and tell the doctor. So if the retention is kind of like a very temporary, for example, like a surgery, like by the anesthesia or by some kind of medication, okay, and our patient is very nervous or anxiety, they cause a muscle spasm. That's why it doesn't pee very well. So that's why it can be like a taking care of like a patient will come back to normal maybe about like a couple hours later. We should not leave the catheter inside the patient. So we just use the in and out catheter. So if this patient is a little bit like a neurogenic, like a bladder spasm, so that's why maybe doctor will leave the Foley catheter there for a couple days, even couple weeks. So make sure the patient, the bladder have fully functioning bed that will take it out. Or the problem is you're gonna put like an in and out catheter every single day, so many times. Okay, so that will increase the infection. We don't want to keep putting in and take it out, put it in and take it out. All right. So this is the assessment and monitor for your nursing care. So check with the lower belly. That means what? See if your bladder is distended, is full of the urine. Okay, and use a portable ultrasound machine. Okay, the ultrasound machine can see how many urine is inside your bladder. How many urine is inside your bladder? All right. Check with all the fluid intake and output. That means what? So whenever patient drink, it should be have a certain number will be have an output, right? I can accept a little bit less, that's fine, but I still want to see if the output is over like a 2/3 output when we are drinking. So for example, if I drink 1000 cc the water, I want to see 700 cc output. I want to see 700 cc because this is at least 2/3. So if you don't reach like 700 cc, I need to know, okay, something wrong. Where is this water going? So either way, is the patient edema right now? Is all in their leg or in the arm or in the belly? Or either way, is the patient has some breathing episode? Or either way, either way, a patient just never drinking that water is kind of false documentation. All right. Please watch out with the infection because urinary retention, that means what? Is the water pool there is good for the bacteria. Bacteria like to swim there. Okay, so that means what? When they see like a retention layer, so that's why they would like to stay there, can drink with all this kind of free water, and that's why they will stay there. It will cause the infection very easy. So that's why please see the symptom if any infection. Help the patient sit up. This is nursing intervention. Help your patient sit up and straight up. So if they have retention, that's why when they sit up, it's by the gravity. That's why they can pee much more comfortable, right? So use a relaxing sound. That means what? With the running water. Okay, running water. And I saw some people use their cell phone. They're just playing with the waterfall. The waterfall sound. I think that's a little bit too loud, but if that's helping them, that's fine. That's fine. I have no problem with that. So that's why the running water actually is helping the patient. They can just relax. And I do have a patient just like to listen to some kind of bird song and some kind of like a classical music. That's fine. And we don't care. As long as you can pee, that's fine. Okay? Insert the urinary catheter. It means this is kind of like an in and out catheter. Right away, if the patient just have an odor, okay, and cannot pee and feel is kind of like urgent. All right. please give the prescription drug medication. Okay, well, helping the patient to pee much more easier. Okay, we're gonna talk about one medication is called Flomax. So this is helping the patient to pee. All right, patient education. Okay, teach the patient. Okay, so for the double void technique, that means what? So you pee a little bit and then you pee later again. Okay, so that means what? When you pee and then you hold it. So for example, you pee like maybe like a first minute and you hold it, and the second minute you hold it, and the third minute, the minute of three, and you pee again. So the reason this is because it's also like a kick-out exercise. We are training your bladder more stronger. So when your bladder is more stronger, the muscle is more stronger. That's why the muscle will helping your bladder squeeze all the urine out next time. So by every time you do this kind of training, so the muscle more stronger will helping you squeeze out with your bladder. Okay, with all the urine. So if your muscle is weak, that means they are not helping to do this job. Your bladder is going to be full of retention of water. All right. So against with the cold and also allergy peel. Okay. So that means what? So with some kind of like a cold medicine. Okay, like a decongestants and also making it harder to pee because they are cholinergic medication, like allergy medication is cholinergic medication. That's what we saw is we say is a dry effect. Remember I told you it's a dry effect. Your mouth is dry and you don't sweat and you do not pee. Okay, you do not pee. So that means what? You don't see anything coming out from your body. That means it's kind of dry. Why the patient is so dry? Because all the water remain inside the body. That's why we want to pull out all the water. Okay, so please limit with the alcohol and the caffeine. Okay, because they can change the body and handle with the fluid, and use a proper hand washing. Because if you want to touch the patient, and make sure every time the patient pee and poo, washing the hand. Usually we let the patient just washing the hand before they touch it with their genital area. Okay, because we will make sure they don't bring any bacteria to their genital area and when they're wiping themselves. Okay, so if not, at least wash one time after the urinate. Okay, at least. All right, this is bladder scanner. That's why we use a bladder scanner to scan a patient's bladder and see how much urine is residual there. So I know some nursing home they do have this scanner. Some nursing home they don't have it because this is kind of like pricey. It's gonna be expensive. So that's why some nursing home they don't care about it, which is bad. They should, okay, because lots of patients they have this kind of urinary retention very easy. So they should, but hopefully, in the clinical, the instructor they know how to use this. They will teach you guys how to use a bladder scanner, okay? Because actually, you're gonna be the one use this a lot in the future. All right. So this one is a medication, temsolonsine, okay, which is a Flomax. Is Flomax. We talk about this medication in the term 2 in the cardiovascular disease because this medication can helping decrease the patient's blood pressure. Okay, the helping decrease the patient blood pressure. That's why I highlight here the right side again. Okay, especially when standing up, the blood pressure will drop. So it's also stated as hypotensive. Also stated as hypotensive. So that means that this patient will taking this medication need to be careful if they are going to be fall. So it's a fall risk. So that's why this medication is not a blood pressure medication. This medication is not treating for the blood pressure from the beginning. The alpha blocker medication is helping to treat enlargement prostate, helping the patient relax the muscle of the prostate. Okay, the sphincter of the bladder neck. That's why they can pee easy. So that will release the sphincter. That's why the patient can pee easy if they have enlarged the prostate. So this medication originally is doing this job. Then we find out the side effect is it will cause the blood pressure drop. So that's why this medication we use it for the two effect. So if the grandpa also have like a PP issue and also the blood pressure is also high. So that's why the doctor will prescribe this medication to treat two symptoms. So one medication take care two problem. Will take care your PP problem, you cannot pee, and will taking care your blood pressure problem, which is hypertensive. Okay, but again, be careful. Blood pressure will drop. So that's why for rest, okay, safety is the issue. All right. So this medication is a capsule. So that means what? Please do not crash, chew, or open it. Okay, please just take the whole capsule and then make the medication dissolve in the stomach slowly. Okay, but if unfortunately the patient is on the G2, so that means what? You probably need to open it. You probably need to open it. So this medication hardly we can order the liquid form, hardly. So that's why most likely we don't have a liquid form. We have a capsule, this form only. So if a G2 patient, that means you need to open it. But usually, please don't open it. Okay, do not open it. Just let the patient take it with a whole capsule. All right. So this medication, we did not talk about one of the severe side effects before. That's why now I'm going to talk about it. Because next semester, the term 4, you're going to learn the eye and ear, these two organs. So if a patient going to the eye surgery, please do not take this medication. So it's kind of complication will cause the cataract and glaucoma surgery. Okay, floppy iris syndrome. That means what? So patient iris actually it will become like a discoloration and it's not kind of like a little bit cloudy. It's not circulate very well. Okay, it's a floppy. It's kind of like they cannot see very well after the surgery. Or either way, either way, before the surgery, if they have a glaucoma cataracts. Okay, so this is the reason. If the patient they have an eye problem, usually we do not recommend to use this medication. We choose other medication. Right? So here, the next PowerPoint. This is the brother training. Okay, what will happen is they use a little girl as a pediatrician. Okay, so when you are little, that's why your brain and your spinal cord connection is not so good. So that's why when you grow up, your brain will start becoming like a boss right now. Will tell you all your body what to do, and your spinal cord will control with your organs. Okay, so what happened is the spinal cord will refer with the bladder message and will tell the bladder go to pee, and the bladder will always tell the spinal cord with this kind of information. They don't tell the brain. So that's why the bladder training is. And so every time you're sitting there, and that's why you let the patient to think about they can control with their muscle. Which the bladder muscle, a bladder muscle have a two muscle is involuntary and also voluntary muscle. Remember this? Okay, it's another in the physiology. So one you can control, one you cannot control. But with the brain, is actually controlling with the outside, that sprinter muscle we're holding. So more stronger, that's why patient can have a better, stronger muscle, can hold the urine. Oh, they can squeeze, can pee out more urine better. So that's why this training actually is by the brain. Brain will be training your bladder directly, no longer get a message from spinal cord anymore. So that's why every morning, if you sit on the toilet, and it's by the schedule, that's why your muscle, when you sit on the toilet, brain tell all the body, okay, go to sit on the toilet, and send this signal into your bladder. That's why your bladder say, oh, now the brain is telling me the signal, telling me the message. That's why I can release. So that's why I can pee, I can poo right now. So that's why the brain will take a control for that. It's no longer a spinal cord anymore. So this is the reason. That's why we say the bowel training and also bladder training can be success. It can be happen. The reason is that let your brain take a control. Okay, but of course, if the patient is dementia or patient have a mental issue, schizophrenia, so that means it's going to be difficult because they don't follow the command, they do not think. That's why the brain is not controlling with the other organ. So that will be difficult. That means that there could be still like an incontinence, like we say it's a functional incontinence. All right. Okay, and any question? Oh, somebody asked me. Yes. Okay. Any question?
No.
No.
Okay, so if no question, I need to call attendance. Okay, because today is actually counting our regular hour, so I need to count attendance. So wait me a second. All right, yeah, let me see. So I have Vanessa. I have a Sue. I have a Bryce. I have a Oscar. And this is Melina. Right, and the next one is Alexis. And this is Alice. And this is April. And this is Rosarie. And this is Ray. And Joey, okay? And Maggie. And this is Urin Garcia. And Kiana. And this is Rizzo, okay? And Susanna. And Aurora. And this is Yuri. All right. Is anybody I didn't call your name?
圆圆
Yuan Yuan. Oh, okay. Yuan Yuan. All right. Did I call everybody already?
Yes.
Yes. Okay.
Yes.
All right. So I will post it on the YouTube. Okay. If you still don't understand very well, you can go in back to see the YouTube. Okay. But if not, your demands. Okay. Just go get some rest. Okay. Because you're gonna have like a quiz on a Tuesday.
Tired.
Thank you.
Okay. No problem. Okay.
Thank you.
Have a
Okay.
good